Hello again, and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis.
Are we back in medieval
She's
times?
so excited.
The way she's talking. She
Oh, no.
sounds like
She sounds like she's excited.
she's a princess held in the castle.
Well,
I don't get that at all.
I'm Lita.
I'm confused.
You can.
I'm confused.
Okay,
And I'm Ron.
I'm still confused.
She's Jean Marie.
Okay.
Collectively, we're the hosts of Podcast DX.
On today's episode, we will be diving into the world of cruise ships. But not the pool decks and midnight buffets. We will be talking about cruise ship health and safety.
That might involve the pool decks and midnight buffet.
It might. Also, how to stay well while traveling at sea. And before you ask, Lita, we are not going to talk about the climate crisis and extra floating icebergs due to the warming seas.
Ah, you know me too well.
Well, let's start with the number one piece of advice from both cruise lines and the Centers for Disease Control and Prevention. Hand washing, hand washing, hand washing. It sounds basic, but it's the most effective way to prevent getting sick in general and certainly on board a cruise ship.
And you'll notice hand sanitizing stations at nearly every turn on a cruise ship. Outside dining areas, entertainment venues, even elevators. Use them often and don't skip the sink when soap and water are available.
And here's one more tip. Wash your hands every time you return to your cabin, before and after eating, and after touching any shared surfaces like railings or buffet utensils.
And cruise lines today are working harder than ever to prevent outbreaks. Ships are required to meet standards set by the Centers for Disease Control Vessel Sanitation Program, at least when it's fully staffed. But we'll get into that in a bit.
On board, crew members disinfect common areas frequently. You might see cleaning crews wiping down stair rails, elevator buttons, door handles several times a day.
And a lot of the modern cruise ships, they're using HEPA filters and advanced air filtration systems to help limit the amount of airborne disease transmission, especially in cabins and in their medical facilities.
Some ships even have medical grade UV light systems in their ventilation systems, especially after lessons learned like during COVID.
Right. One of the most notorious cruise ship villains is the norovirus.
Makes me feel sick to my stomach just thinking about it.
It spreads easily through contaminated food, water, surfaces, and even handshakes.
And actually, the norovirus causes sudden onset of vomiting and also diarrhea. No pun intended, but it spreads fast. Cruise ships are the perfect storm of close quarters and shared spaces.
But the norovirus isn't the only concern. Respiratory illnesses like the flu, COVID-19, RSV, and even the common cold can spread through shared air and surfaces, especially indoors.
Right. That's why the CDC recommends getting your flu and COVID vaccines at least 2 weeks before you sail.
And also, if you're immunocompromised or just cautious, do not hesitate to wear a face mask in crowded areas.
Sure. And it's always smart to bring a list of all your current medications and major health concerns along with you when traveling anywhere.
Right. Keep your medications in their original labeled bottles and pack a printed list of emergency contacts, including your primary care provider.
Some cruise lines offer telehealth services on board also, but if you end up needing care at a port stop, having your full medical information on hand could be a lifesaver.
And here's a non-medical tip that could still protect your health. Arrive at your cruise departure city a day or two early, and that'll help reduce stress.
Right. And it also gives you some wiggle room in case of flight delays. It ensures that you're rested before boarding the ship. There's benefits.
Yeah.
And if you're visiting or departing from foreign countries, make sure that your passport is valid for at least 6 months and check to see if you need visas or any other health declarations because some countries are very strict about documentations at their port.
And it's a topic most people don't want to talk about, but cruise vacations can sometimes come with risky behavior, including unprotected sex with new partners.
And STI transmission is a real concern. Be safe, bring protection, and understand that ships usually don't stock more than the basics in their medical centers.
And while no one really wants to think about it, consent laws also apply at sea. Cruise lines have formal protocols for reporting sexual assault and harassment.
And earlier we mentioned the CDC's Vessel Sanitation Program, or VSP. It's a federal program that inspects cruise ships for cleanliness, food safety, water quality, and overall sanitation.
However, as of 2024, the CDC announced it would be cutting several cruise inspector positions, raising concerns among public health officials.
Even though, I'm sorry.
Right.
And these inspections are funded by cruise lines, not taxpayer dollars. They play a big role in keeping passengers safe.
So that makes no sense.
Yeah.
With
Love to
fewer
edit that.
inspectors and coordination, some worry that ship conditions could decline or that outbreak response could be delayed.
If you feel unwell on a cruise, don't wait to report it. Most ships have 24/7 medical centers with doctors and nurses on board.
And it would be nice if you watched out for some of the following signs.
And report them.
Yes. So sudden vomiting or diarrhea. Again,
I was going to
Okay.
say, did you just say diarrhea? I've
did.
never even heard of that. Is that diarrhea on vacation?
It is now.
Okay.
So watch for signs like sudden vomiting or diarrhea, fever and chills, a persistent cough or skin rashes, or difficulty in breathing.
Ideally, if you have any of those signs or symptoms before taking a cruise,
Don't go.
don't go.
Because
Which-
everybody else doesn't want it.
Well, actually, I'm going to sidestep a little bit.
Yeah.
If you do have that, when you're booking your cruise ship, get the travel insurance in the event you're not able to go.
Okay. And prompt medical attention not only helps you, but it helps protect your fellow passengers.
Yes. If you're diagnosed with something contagious like norovirus or COVID, you'll likely be isolated in your cabin for at least 24 to 72 hours, depending on the illness.
Right. And some of that treatment may include an oral rehydration, antiviral medications, or even symptom management. Plus, lots of room service and bottled water.
And cruise lines also coordinate with port health authorities if disembarkation or emergency transportation is needed.
Yeah, I've heard horror stories
Okay.
about pricing for,
So it's better not to go if you're
Yes.
starting to feel sick
yes,
than
rather than have a
emergency flight home. Yeah,
$45,000 helicopter flight from the ship to the port.
right.
But remember that trip insurance.
Yes.
I don't know if that would.
I don't
Well,
know if that would
that's
cover it.
separate. That's health insurance,
Yeah.
travel health insurance.
Again, that's
Yeah.
something to consider.
Think about, yeah.
Well, you can reduce your risk by following a few simple rules. Wash your hands often. We started
that's-
with that.
That's shocking.
That
It's
you have
shocking.
to tell people that?
Yes, that people actually don't realize that washing your hands is an important part of staying healthy.
Avoid touching your face. Use hand sanitizer. Stay hydrated. Get vaccinated. And be honest on your pre-boarding health form.
Also, be mindful of undercooked food, especially at buffets and on shore excursions. Remember to stick with hot, cooked meals and bottled drinks when in doubt. That just makes sense.
Yeah. So what's on the horizon? Cruise lines are investing in real-time health tracking apps. I wonder if they're doing wastewater monitoring. Upgraded shipboard medical facilities, touchless dining and boarding processes, AI-based contact tracing, and outbreak prediction. And it's usually I've read a lot of things about cruise ships. It's usually the passengers, not the staff, because the staff are washing their hands
Hmm.
all the time. So they're eating in the same kitchens,
Yeah,
but they're not mingling or they're making sure that they're washing their hands.
right. Well, the pandemic changed how people are thinking about cruising.
Okay.
Today, passenger health is part of the vacation planning process, not just a fine print disclaimer.
Exactly. And that's a good thing. It means safer ships, healthier passengers, and smoother sailing all around.
Come on. Okay.
Yeah. And remember that this podcast is not intended to help you plan your cruise vacation. It's also not a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Just know that the views and opinions of the guests and hosts on this show do not necessarily reflect the views of PodcastDX LLC.
Thank you for listening to this episode of Podcast DX. And I'd like to thank also the group called FeedSpot, because FeedSpot has selected us to be in the top 60 healthcare podcasts on the web. And we will be putting our new award badge on our website. Now, whether you're on a cruise or whether you are a cruise veteran, I'm just a veteran, or planning your first voyage, remember, a little preparation goes a long way.
Safe travels, everyone. And we should
Wash your
mention
hands.
again, wash your hands.
Wash
Wash
your
your
hands.
hands. Wash your hands.